This is Jerry Hesch of the Hesch Institute, and we are looking at Cindy's feet and ankles and her fibular head, and so I'm doing my best to have her line as symmetrical as we can get her. And I palpate the fibular head here, and we have this ruler placed against a square device to hold it perpendicular, and Mark is measuring the distance at the top of my thumbnail, and I perceive that I'm on top of that fibular head.
It's right at 1 inch.
So that's at 1 inch, and then if you'll come around and we'll do this side, please. It's a little tricky dancing around. There. It's pretty remarkable, the difference in the
Rearrange here. That's going to be more like 3/4.
and that's precisely what we saw
Yeah.
the previous time. 3/4 on this side, 1 inch on this side.
Yeah.
Now, if I look at her tibiae, they seem really symmetrical in terms of my ability to perceive such. But when I look at the fibulae, distinct difference,
Well, and even
perceptible difference.
For me, the perception of where your hands are feels different.
Interesting. And that's the same throughout the the thigh as well. There isn't that sense of asymmetry. There certainly is as we get to the pelvis, but we're going to focus only here on the fibular head. Can you now line your stomach?
Sure.
I'm going to want your feet off the
Off
edge.
the table?
Yeah.
Okay.
Okay, now what I like to do here is make every effort to have the client line in a symmetrical position, and that includes the position of the feet. So I'll bring them together in fairly neutral as best I can do with my crude measurement here and visual, etc. Or I can just back off it. Doesn't change much as I'm looking at her legs. Whether I stabilize pushing into her body or not doesn't change things much.
It does for me in that fib head. I feel it more with the push at the 90 degrees with the foot.
Don't understand what you feel.
You feel more pain?
Yeah.
Oh, you feel more pain when I dorsiflex.
Yep.
Very
At your
interesting.
fib head.
All right, so Mark, let's measure this again, please. That's the fibular head.
That's going to be 1 7/8.
1 7/8.
Yeah.
Okay, let's do the other side, please. Visually, this is so dramatic how
Yeah,
pronounced that looks.
Are you good? That is 2 1/4.
2 1/4. Okay. And I know that with the camera, I just don't think we're going to be able to capture it, but this part of her
Yeah, it just
anatomy
looks
looks to be so pronounced. And when I come down and look at the lateral malleoli, I'm not seeing a huge asymmetry. When I look at thigh musculature, I'm not. It does change when we get to the pelvis. We're going to film that separately. But we're going to stop here and just show how we perceive a difference in the positioning of the fibula. And it also correlates with a mobility test. So if I hook this and I spring it at about a 10 to 20 degree angle, I can't even load that structure. So I'm not going to be able to spring test it. Okay? On this fibular head, it doesn't have a lot of mobility, but I can take up the slack and I can induce a little bit of give, like a very, very strong shock absorber. That's what this feels like. This, it's just not yielding.
Doesn't move at all.
Right. And we also noted that the subtalar joint, I can abduct the calcaneus here, and I can see the whole forefoot. And, abduct. I can see the whole foot abduct about 15 degrees. On this side, I won't keep you long.
Thanks. It's
Okay.
just I think it's the book, like the
Okay,
hard.
I'll get you right off it.
Okay.
1 second. I can't get any abduction here at all. And I can see that this is sitting in more inversion versus this one. There's just no available abduction. Doesn't move at all. Okay, so we'll stop filming here.